So we are really, really thrilled to welcome back Liz Altankara today to talk about eating disorders and COVID, which I think is a really sort of timely topic. She's the Director of Education at the National Eating Disorders Association.
Today, we're going to be talking about COVID-19 and eating disorders. So I like to start this presentation with a quick, brief overview as a refresher, and then we'll be talking about COVID-19 and the effects of the pandemic on this population. So I'm going to provide an overview of eating disorders, and we're going to discuss the effects of the pandemic on the individuals experiencing an eating disorder, and then we're going to outline the needs of this population. And also, we're going to see how eating disorder treatment adapted to the pandemic, and the challenges that it brought. So next, eating disorders 101. What are eating disorders? So the answer is eating disorders are very serious but treatable mental and physical illnesses that affect people of all genders, ages, races, religions, ethnicities, sexual orientations, body shapes, and weights. As an organization, we really want to dispel the myth that eating disorders only affect a specific population, because historically, when we talk about eating disorders, people used to think only about thin, white, affluent women. We know that that's not true. We know that eating disorders don't discriminate, and any one of us can be affected by an eating disorder. That's very important to remember for a variety of reasons, but also when we think about access to care. And the other thing is eating disorders involve extreme emotions, attitudes, and behaviors surrounding weight, food, and size. But that's not just about weight, food, and size. So there are a lot of issues that may put somebody at risk to develop an eating disorder. And here, as I say, eating disorders really are caused by a range of biological, psychological, and sociocultural factors. But that's another very important point to remember. And we said they are serious, life-threatening, and treatable. I want to emphasize that there is always hope. We believe that eating disorder recovery can happen with the right help and support. But also, it's important to note that eating disorders are not fads or phases. Some people think that eating disorders are choices. They are not. They are very serious illnesses, and they also have the second highest mortality rate of any psychiatric disorders, surpassed only by opioid addiction. When I share this, people usually get surprised because if that's the case, why aren't we talking about eating disorders more? So that's what we are trying to do with our mission. We want to raise awareness of eating disorders and get public attention so that more resources are available to those who are affected by them. And the other very, serious and shocking in a way statistics is every 52 minutes, one person dies as a direct consequence of an eating disorder. So they have serious effects on health, productivity, and relationships. As I said before, they involve extreme emotions, attitudes, and behavior surrounding weight, food, and size, and early intervention increases likelihood of a full recovery. So that's why it's really important to know the warning signs of eating disorders and also seek help as soon as possible. And we know that sometimes that may not be possible for a variety of reasons, but at least it's helpful to get screened. We also have a screening tool on our website when you go to nationaleatingdisorders.org. So that could be a good place to start for many folks. Who do eating disorders affect? Everyone. We said this before, so it doesn't really discriminate. And also, when you look at the US population, 9% of the US population, which is around 28.8 million Americans, will have an eating disorder in their lifetime. And when we look at children and adolescents, we know that that's really the time frame when eating disorders can start affecting people, even though individuals of any age can suffer from an eating disorder. But 22% of children and adolescents worldwide show disordered eating. That's a big number. And again, disordered eating may lead to a full-blown eating disorders or may not. So that's why intervention is critical at an early stage. We said biopsychosocial illnesses. So let's talk a little bit about the biological factors. Family history, like if you've had anyone else in the family who's been affected by an eating disorder, history of dieting, this is a big one. We know diets are very dangerous and they don't work, and they can also put people at risk to develop an eating disorder. Type 1 diabetes and genetic predispositions are some of the biological factors. And psychological factors are perfectionism, body image dissatisfaction, not being satisfied with your body, personal history of a mental health condition. And we'll also talk a little bit more about this. Eating disorders have a big co-occurrence with other mental health conditions. So if you suffer from an eating disorder, you may also suffer from mood disorders, anxiety disorders, and other kind of mental health illnesses. And the other psychological factor is impulsivity and cognitive inflexibility. which really means that black or white thinking. So not really any flexibility in your thinking patterns. And some of the social factors are weight stigma, teasing or bullying, appearance ideal internalization. And this really implies, that idealistic image that we see in the media in our society. Usually, thin bodies are glorified and there is this ideal look that everybody is trying to attain. That is very dangerous because we are all unique. Our bodies are unique. Instead of really celebrating the diversity, we are in a way that all of us are affected by these appearance ideal that is really promoted and that we are exposed to. For those who really internalize this appearance idealization, this may put them at risk to develop an eating disorder. And again, social factors, limited social networks, and also personal experiences of trauma put people at risk to develop an eating disorder. We see a high prevalence rates with co-occurring illnesses, and these can intensify eating disorder symptoms and also impact treatment in terms of recovery time, level of care, dropout from treatment. And most common comorbidities are mood disorders, anxiety disorders, and substance use. And we believe that treatment should address coexisting conditions and eating disorders at the same time. So they should be addressed at the same time to be able to give the person to full recovery. Let's talk about COVID-19 here. So how the eating disorder population was affected by COVID-19. So first of all, again, I like to take everybody back to at this point, how many years has it been? Almost 4 years or 3 years. And at the very first time when we heard about the pandemic and then, all the shutdowns happened, we all had daily life disruptions and restrictions. And this wasn't really only harmful for those affected by eating disorders, but anyone, right? Like anybody, let alone somebody who is dealing with a mental health condition. And the other thing that was brought up was the effects of the media. So one thing that happened during the pandemic, and I want to emphasize that those are things that are still going on. We are not done with the pandemic yet. We may be out of the thick of it, but we are still dealing with it one way or the other, even though we may be more accustomed to live with it. So I like us to keep that in mind as well. But effects of the media, we started spending more time on social media, on Zoom, like such these meetings, and they're still going on. And especially on social media, we started kind of new trends emerging. And as I said before, young children are accessing social media more, so they're affected more about the trends that they are seeing. Like people have been posting cooking videos, or they were posting like videos where they were trying to beat the pandemic, weight gain, things like that. So, seeing things, especially if you're already at risk to develop an eating disorder, was really hard for people to see. And again, the next thing that we were all concerned about was fear of contagion, right? When we talk about, and we still are, about COVID. And as I said, eating disorders can be co-occurring with other conditions, whether it's OCD or depression or anxiety. So really living in that atmosphere where you're always fearful and high alert exacerbated the symptoms of those who are already experiencing eating disorders. And the other factor was isolation and lack of support systems. And again, let's think back at the very beginning of the pandemic where we were all kind of shut down, really isolated from our support systems. So let's say if you're somebody who were already in treatment, some treatment facilities had to close down and switch to Zoom, which made things difficult, right? I mean, it's not the same connection that you have when you are right next to your treatment team. Or the same thing is true if your support system consists of your friends and now you don't really have access to them. You can just call them as opposed to seeing them and spend time together. That really created a big challenge for those who were affected. And again, the next point in terms of disruption and access to treatment and care, even though I should say the treatment field adapted fairly quickly, and we also see kind of the changes that happened to that time carried on to nowadays. And I'll be talking a little bit more about them, and some of them are positive. So that's another thing to keep in mind, though. There were initially a disruption in access to care. And lastly, scarcity of food. We all saw those videos where people kind of couldn't find food, the kind of urgency, go to grocery stores and stocking on food. And especially, as I said, eating disorders are not just about food, but it's the component of it. So just having to worry about food really triggered those kind of issues with people. And I like to share some of the studies that have been done like in the following years. So during pandemic, we have seen an increase in adolescent, young adult eating disorder related inpatient admissions, hospital stay, outpatient care inquiries, and that's unfortunately a trend that we still see today. So there has been an increased number of people affected by these illnesses. And the second one is really shocking. Actually, the proportion of ER visits due to eating disorders doubled among adolescent females. So when we were talking with treatment providers, one thing that we heard over and over again is that the acuity went up. So basically, people were being admitted, but their symptoms were even more serious and severe. And there could be a couple of explanations to this. And one of them could be the delay in accessing care, right? Like, especially at the very beginning, people, even though they were ready to get help, if they waited and waited until things kind of went back to normal, then they started presenting more serious and severe symptoms. We've experienced a disruption in daily life, isolation, increased social media use, and also concerns around food accessibility, food insecurity, and limited access to healthcare created the perfect storm for people. Again, when I say perfect storm, I guess, we've started hearing from people who developed an eating disorder for the first time during the pandemic, and also who came to us and told us that they are in a relapse. So they were feeling better, and then all of a sudden this huge thing happened, and then they found themselves engaging in disordered eating behaviors again. So there's twofold, people who are experiencing eating disorders for the first time, as well as those who started experiencing a relapse. What does this community, eating disorder community, need? Increase awareness of eating disorders, and that is really important. I shared with you some very shocking statistics. Eating disorders are more common than we think, and also when I'm sharing those statistics, I'm only talking about diagnosed eating disorders. And we also know that there are a lot of people who may have eating disorder symptoms, who may not still have a diagnosis, or who may be dealing with disordered eating, who doesn't really qualify for an eating disorder diagnosis, but whose life are equally disrupted. So it's really important to keep in mind. So there's kind of this continuity and spectrum. So that's why, at the National Eating Disorders Association, one of our mission is really create awareness about eating disorders. And I just want to add in here, this is a very timely conversation. Next month, at the end of next month, we'll be celebrating Eating Disorders Awareness Week. So it happens every year at the end of February. So this is really a week-long campaign where we are trying to raise awareness on a national level. So you can go to our website at nationaleatingdisorders.org. We have more information. I mean, everybody can do their part to raise awareness, even little things. So we highlight ways anybody who's interested can raise awareness on our website. And the other thing is really access to affordable treatment and support options. I mean, I'm not going to lie, eating disorder treatment is very costly. And we all know the issues that everybody deals with insurance. And we all know that there are a lot of people who cannot afford health insurance. So how are we going to fix this, right? This is a big problem. And also we know that early intervention and treatment really helps with recovery, right? So that's why, I mean, there are different, on our website, when you go, you'll be able to find those. There are some affordable care options. There are some low-cost support options that are available. But again, our goal as an organization is also work with other organizations in the advocacy field so that we can kind of help ring the alarm, and so that more can be done in terms of access to treatment and insurance companies and everything about resources. The other point is supportive online communities. As I said, a lot happens on social media. There are so many different platforms now. And as an organization, we also work with these platforms to help them create safer spaces for those who are affected by eating disorders. But still, there's a lot to be done. We've all heard about algorithms, when you search something and then more you see in your account, in your feed. And there are a lot of accounts that may promote disordered eating behaviors, or we see a lot of accounts that promotes weight loss, dieting tips, and all that. And those are really, really harmful for those who are affected by eating disorders. So for that reason, our goal is to really work with these platforms, social media platforms, to share kind of our knowledge and to advocate for those who are affected by these illnesses. And the other thing is, that's the safer online platforms. And we also know that there are folks that use social media to create communities around recovery. So they can also be used in a supportive way. Especially this started happening during the pandemic because, we couldn't leave our houses and we were kind of stuck inside and we relied on social media to have that connection. So that's the other part of it. I mean, there is a way where it can supplement recovery, but that's why I guess it's both ways. Social media companies, they have a lot more to do, but at the same time, I guess we can also educate ourselves and be more mindful, of the content that we are engaging in social media. We should see more emphasis on prevention efforts. Eating disorders are preventable illnesses. So we've heard about the mortality rate. What can we do to prevent people from getting these illnesses? So that's a very important point. We know that there's research being done in this area. However, that's another issue with eating disorders. There's not enough funding for research. Even though that's such a serious issue in terms of government funding, we don't see as much funds going to eating disorders. So that's another point we are trying to create as an organization and advocate for. And the other very important point is centering lived experiences. Eating disorders, we talk about signs and symptoms of eating disorders. There's a variety of signs, like we can talk about the DSM diagnostic criteria, like all the medical stuff. However, I think it's really important to highlight the lived experiences. As I said, eating disorders affect everyone. And even though eating disorder symptoms, like there's a universal set of symptoms, the experience of an eating disorders can be quite different. So for that reason, one thing that we are also trying to do is highlight lived experiences. I mean, there's, especially in underserved populations, the way eating disorders present themselves are quite different. And also the causes of eating disorders in these populations are quite different and can be tied a lot to past trauma and things like that. So that's why it's really important to have that perspective and hear what people have to say, because it's not all research. We know that, research is limited. That's why we really have to rely on lived experiences as well. And let's talk about treatment during the pandemic. As I said, this is not just during that, 2020 year period, but loss of support systems, that was a big thing initially. And then, with the Zoom and the virtual treatment options that got better, there have been a lot of challenges with access to care. And as I said, I mean, initially, especially when residential and inpatient treatment centers stopped accepting new patients, and then, a year later, they said, okay, we are at a point where we have the precautions so we can accept new patients. There has been long wait lists. Like we've been hearing from people saying that I have to wait 6 months just to be accepted to a treatment facility. So that has been a big challenge. And that's why I guess nowadays you may have heard of a few treatment programs that are all virtual and that can also be like applied to different levels of care. Those kind of are emerging and becoming more popular, and then research is being done on them and they are being more effective. So it's good to see that we are kind of seeing some alternatives to, I should say, like typical treatment settings, which increases access to some people. Prior to my position as the director of education at NIDA, I used to oversee our helpline at NIDA. And that's something that we used to hear from people a lot. I mean, not all over the US we have eating disorder treatment facilities. I mean, some people had to travel hours and hours just to see an eating disorder therapist, which is a lot. I mean, especially if you're seeing a therapist on a weekly basis, it's a lot for somebody to commit. Not everybody can do that. So the virtual treatment options really increased access in those terms. And the current treatment landscape, we started seeing kind of a combination of virtual and in-person treatment. They call it hybrid treatment. So let's say you go to the facility a few times a week, and then you can also do like virtual sessions with your therapist or with your treatment team. So there are a lot of options that are available now to folks. Unfortunately, the access issues still exist, in terms of financial access. So that's something like we still have a lot of work to do in that area. However, at least now we know that there are more eating disorder specialists that are available to support the community, but we always need more. I talk about the hybrid treatment models, and we also saw an increase in the number of individuals seeking treatment. You've seen the statistics, like especially like with the ER visits, it doubled. So a lot more people started struggling with these issues. We've seen virtual only treatment options. And also there have been some other online communities We started seeing online support groups for various populations based on race, gender, sexuality. As I said, like people started to realize it's a different type of experience depending on your identities. So that's why support and recovery should really be tailored to the person, to their individual needs. So we started to get that understanding, but again, there's a long way to go, but at least it's great that that conversation started during the pandemic and we continue to talk about these different experiences, which are really, really important. So if you like to visit our website, it's nationleadingdisorders.org. And I also would like to share that over the past year, we've been working in a big project. We've been trying to create a resource center on our website. It's up now. So if you go to our website, you'll see that it looks different. We had a website redesign as well as a resource center. And we divide the resource center based on journeys. So if you're an individual who is personally affected, you'll go through a different journey as opposed to if you're a parent of a child with an eating disorder, as opposed to you're a professional new to the field. So we have different journeys. Check it out. We are always very open to feedback and we'd love to hear from folks because this is really the beginning. We like to add content and all of our content are vetted by experts in our field. So we work with our advisors to update the content and we are hoping that this is going to be a valuable resource to those who are affected. Or you can also send us an email at info@mynida.org. And I briefly want to put up my references. Those were kind of all the studies that I referred to throughout the presentation. When you think about eating disorders, as I said, they are very complex. There are so many different components to it. So that's why you really have to take into account the person's identities, past experiences, and why are they engaging in disordered eating behaviors. It may not just be because of their desire to attain certain body type. There could be other factors into that. So that's why, as an organization, we love to center lived experiences, and that's what we've been trying to do.
The idea too, like you're saying, is like that there is an ideal body type, that there's one way that people should look, that there's a certain amount that people should weigh. It's just something that actually does damage to all of us, even if you don't have an eating disorder.